We're going to talk about a few different techniques. I think I'm going to teach you 4 because a couple of them are fingers and you're pretty comfortable with fingers, but you may not be using the fingers this way. So we'll start with those and then we'll move to the other ones that may be less comfortable for you. I do a lot of times use my 4 fingers as a grasping tool on the far side. So I'm stabilizing the head and I'm reaching under the neck to grab the paraspinals on the opposite side. So I'm at the right corner of the table with my right hand under the neck, but I'm grabbing her splenius, cervicus, and capitis muscles on the left. Then I'm going to be strumming them by pulling my arm back. But instead of just leaving her head stationary, it wants to move, I'm going to go with that. So I'm going to gently laterally flex the cervical spine when I reach in, and then I'm going to laterally flex it the opposite way while I strum back. Don't go fast. We don't want to give anyone any vertigo or make them dizzy with head movement, but gently moving the spine side to side while strumming those paraspinals. So I'm reaching in with my right, pushing, trying not to put pressure across the throat. I'm pushing more in the base of the area between my thumb and my index finger, pulling with my left hand, gripping the paraspinals, and then pushing with my left hand as I pull with my right, strumming across with those 4 fingers. So my fingers are only really holding shape, and my arm motion pulling back is what's creating that cross fiber. Then I would switch and come to this side to do the opposite. So I'd be stabilizing with my right, reaching under with my left to grab those paraspinals so that I can strum across, and then I'll get that neck lateral flexion going back and forth. If you want, you can make it even more complicated and add in some rotation where you let that cross fiber strum gently counter rotate the head. Just like that.
It is delicious.
It's terrible. Practice more. So
I don't think he's got it down yet.
another 20 years of practice, I'll get that one down. A lot of my favorite Tui Na techniques I learned long before I went to Chinese medical school. My martial arts teacher's traditional Tui Na was head and shoulders better than the stuff I was taught in school. I learned a lot of orthopedic exam and evaluation and assessment through the Tui Na class in school that is valuable and I do all the time. But as far as actual body work, if all I had learned is what I learned in school, I would be unprepared to do good body work. This next technique is a finger pressure technique, but it's really a mobilization of the whole neck. So we're trying to gently move the neck through its range of motion. I want to make sure that I have been clear that mobilization is not manipulation or adjustment. We are not popping and cracking. There's no fast acceleration. No, they call that high amplitude, short duration thrusting. We're not doing any of that. We are simply moving the body through its normal range of motion gently, which lengthens and shortens muscles in consecutive order, which is fabulous for softening up the area and relieving pain. I am going to be using pressure with these 2 fingers up under the occiput on each side, one at a time as I do this. Middle and ring fingers, but it depends on the neck. Sometimes the leg gets 1 finger in there, sometimes all 4 of them fit up under the occiput. Just depends. We're going to be pushing into that same little crevice or depression that we were using with our elbow earlier. You may want to move the camera over to the side because I'm going to stand up to do this one. You don't have to do it standing, but I like to use my legs and not my arms to hold their head up. So I'm going to take my right hand and I'm going to reach under just like I was before, but I'm going to grab that spot on this left side, and then I'm going to move her head and roll it into my other hand, placing these fingers in that spot. Trading her hand. So I'm laterally flexing and then rotating the head, laterally flexing and rotating the head back and forth. This table's a little low for my height, but that's okay. Just get a leg workout.
So those 2 have a similar motion. the one you just did and this one, the easy transition?
It is. This one is a really good thing to do, either very lightly as a warm-up at the beginning, or more commonly I use it at the very end. And it gives me a sense, if I do it at the beginning, of kind of where the restrictions in movement are, so where I might need to go to work. And at the end, it lets me see how much improvement I've gotten in range of motion. If their head barely turns when I get started, at the end I'm getting that head all the way to the side and rolled, and all the way to the side and rolled, then I know I've done some good work. So those are fingertips, but fingers aren't thumbs, so you know, it's all good. And that gets you moving the neck around a little bit, which is my approach to body work. The more I can get the body moving, the better. A lot of restricted range of motion seems to be the body guarding, where it hurt when it went this way at one point, so now it doesn't want to go this way. And it's tightened all this up over here, so it doesn't go that way because it hurt. And if you can bring it that way gently and show the brain and the body that doesn't hurt, it's okay to move that way, then they'll loosen up and start moving that way. So I like both of those. The next two are harder to see because I'm going to be under her neck. So I'm going to imaginarily treat a neck in the air first, and then I'll show you what it looks like on a person. So this next one is going to use the head of the second metacarpal, which we've been using in a fist configuration already. But we're actually going to use it with the hand open. So I'm going to be using this side of the index finger's punching knuckle. And I'm going to put it up under the neck on either side of the spinous process. So I can be on the same side pushing up, or I can come over to the far side and push up on her neck. So I'm going to feel in here, find where the spinous process is, come over to the corner of the table. I'm going to slide my hand underneath here, try not to get any of her hair. And I'm going to roll my hand vertical so that knuckle is gently pressing up next to the spinous process. All right. Again, we're working with mobilizing, not manipulating. So I'm just going to gently push up and diagonally that direction with that knuckle and pull back. And I'm going to release. I can walk up one vertebral level, gently push up and release. I could walk down anywhere along that spinal trough that I want to work. My thumb is hanging out on this side of her neck, but I don't want to press into her neck with it. It's just loosely touching her. My knuckle, this right here, is what's pushing, just like up and across. So my trajectory of pressure, or vector of pressure, is at a diagonal like this.
So your fingers are straight out?
Yep, just like this.
And this hand is working as hard as that?
Yes, well,
And not as
close to as hard. I want her neck to move. I don't want her head really to move, so I have to kind of stabilize it. All I'm doing is getting a little bit of extension and a little compression in those paraspinals together. So I'm extending the neck and I'm pressing into the paraspinals. I can come underneath to the far side, really bury my hand under there, and pull more straight up with that knuckle to get a little bit of rotation in those vertebrae. But that is tougher and may or may not feel as comfortable on you. For them, it may or may not change how it feels a whole lot. I don't know how that feels to you.
Does that feel different?
Yeah, I didn't like it as much as the first one.
No worries. So we call that the tiger's mouth. This in Chinese martial arts, the area between your thumb and your index finger is a tiger's mouth. I'm using that one bony spot though. I'm not using the thumb. It's just out of the way. If you want to work the far side especially, but really either side, and that position is awkward on your hands or on the patient's neck, depending on their neck, the radial styloid process is a great stand-in. So I can slide my whole hand under her neck, roll my hand into that vertical handshake position, and now, especially if I want to work the far side, I can gently pull up and press in next to those spinous processes with that radial styloid process.
Is that easier than the...
It's easier on your hand. It's tougher to be on the same side. I would say just stick to the far side for now, and even pulling back a little bit into the neck can feel really good. So the beauty of this is my hand is completely passive. I don't need it. My forearm is doing the work, which means my bicep is doing the work, not my hand muscles. So I can manipulate the neck a little bit in that mobilization rather, and gentle pressure into those paraspinals. And the more comfortable you get with it, the more comfortable you are at saying, okay, my styloid process is right up under the occiput. I can apply pressure here. I can drop down a little bit, get close to C3, push up in here, I can drop down a little bit, more C5 and 6, and put pressure up there, and kind of work my way through the whole spine, and my hand just gets to hang out for the ride. The tricky part is not doing the hitchhiker thumb. Everybody wants to help, and that thumb will come back forcefully, and you're not hitchhiking. So, easy peasy. So, we had the strumming with the fingertips from the far side where we're moving the head around. We had the pressure under the occiput where we're doing what's called nutation, which is a figure-8ing motion. Right, so we're moving the head all the way through its range of motion all around. And then we had our tiger's mouth pressing in next to the spine and replacing that with the styloid process. Press it.